Inside Africa, in association with Zenith Bank.
Testing, even though they are still scared, but they are testing.
The last time I tested, it was at work, and I encouraged my friends to come with me, and they got tested. And I'm happy to say that we're all negative.
Welcome back to Inside Africa's special World AIDS Day show. One of the biggest obstacles we all know in Africa's fight against AIDS is the stigma attached to people who learn they're HIV positive. There's a new program, though, that shows that many people will actually get tested if they can get protection from other common illnesses in the bargain. Gary Stryker explains.
It seemed like a carnival. Huge crowds gathering for a good time. Yvonne Chaka Chaka singing some of her biggest hits. With comedians, traditional musicians, and acrobats. By appearances, you wouldn't know this is a serious public health project in Western Kenya. And that all these people, standing in lines and waiting for hours, were here to get protection from malaria and diarrhea, and to have themselves tested for HIV infection.
What makes this project unique is it's actually using the needs for health prevention in malaria and in diarrhea, but using that as a way of encouraging people to come forward and be tested. And the biggest problem with HIV control today is the need to actually get people to know their HIV status.
Kenya's goal is to test 80% of its population for HIV by 2010, but the current figure is less than 20%.
Our aim is to make sure that 80% of the community know their HIV status, to help us in controlling new infections and being able to care for the ones who are living with HIV and so reduce deaths related to HIV/AIDS.
But convincing people to be tested is a major challenge anywhere, especially in small communities, where anyone who is even suspected of testing positive for HIV can be stigmatized, shunned by family and neighbors. Many prefer not to know their status.
Initially, we did a small survey and found the community's concerns, why people don't want to come for HIV and AIDS. The issue is, when I know my status, what happens to my life? What happens to my career? What happens to my family?
That's why this week-long prevention demonstration project is seen as a huge breakthrough. The crowds here heard from Kenyans living with HIV, testifying how they manage their illness and live normal lives by taking antiretroviral drugs provided by the government. How HIV infection is no longer a sentence of death. And by the thousands here, they volunteered to be tested for HIV.
Here they're actually within their community, with their neighbors, with other people within their community, being tested openly, and hopefully through that process we can actually try to break some of the very big issues around stigma.
The concept for this project is combining multiple disease control interventions into one integrated campaign that reaches thousands of people at one time. Just by showing up, everyone gets a care pack with a free insecticide-treated bed net to protect against malaria, a high-tech water purifier called Life Straw to break the cycle of chronic diarrhea, and a supply of condoms. And then confidential HIV testing and counseling. The Swiss manufacturer of these bed nets and water filters donated the products and underwrote the expenses of the campaign.
We have learned, which we suspected, that the response to malaria, diarrhea, and HIV is so much more powerful united than apart.
As in much of the country and across Africa, malaria and water-related diarrheal diseases are the primary killers in Western Kenya. And for victims of HIV with impaired immune systems, chronic diarrhea is a leading cause of death. That's why proper use of insecticide-treated bed nets and water purifiers has the potential to reduce deaths from malaria, diarrheal disease, and HIV/AIDS. In this demonstration over a period of 7 days, at 30 sites in an area near Kakamega, More than 50,000 care packs were given to individuals and families. Nearly 47,000 tested for HIV. Among those, 2,016 tested positive for the virus, about 4.3% of the total.
We need to be certain that those people coming forward and actually being positive are adequately looked after, that they get into support groups, that they get on treatment as necessary, and that we actually look after them.
And in the months ahead, if all these bed nets and water purifiers are properly used, there should be dramatic improvements here in public health, from a campaign that could be a model for others in Africa. In Kakamega, Kenya, Gary Stryker for CNN.
Well, that has to be it for this, our special World AIDS Day edition of Inside Africa. I'm Jim Clancy. I just to say we'll be back next week with a brand new show. Thank you all for being with us.